Hi, I'm Dr. Lowery with Injury Care Centers. Today we're going to discuss cervical spine injuries and just some of the options of working with it, some of the mechanics behind the injury itself, and just some of the ways you can deal with it from an injury perspective or from a wellness perspective. At Injury Care Centers, we have an integrated team that we take a multidiscipline approach of how we handle it, whether it's injury or health-related type injuries. So we have special types of treatment like PRP, platelet-rich plasma. We have stem cell treatment. We have some of the higher modalities, such as piezo, which breaks up the scar tissue. We have laser to enhance the healing process. So, we take a multidiscipline, approach to how we can facilitate the healing. So some of the things that we're going to discuss are just the breakdown of the spine today for the neck. When patients come in, we look at it from a perspective of, is it injury related? With an injury related, we need to take x-rays. We can do our own radiology. All our facilities can handle the radiology. If there are more extenuating circumstances like pain down the arms, then we would do an MRI, which we have our own MRI to be able to do that. So depending on how the person comes in, that would dictate what type of testing, but we would always start off with x-rays to see what kind of structure we're working with. And some of the mechanics that when we approach it is the breakdown of the neck itself. So if we look at the cervical spine has really got three components to it. You have an upper cervical, you have a mid cervical, and a lower cervical. So when people come in with headaches or more neurologically based injuries or deficits or anything like that, trigeminal neuralgia, vertigo, things like that, then we're going to concentrate more on the upper cervical aspect of the spine, which would be C1 occiput in that region. That whole area of the neck functions differently. If there's a rotational component to the injury, it could be a car accident where there was the car was hit and there was some rotational component to it. So most of the rotation is going to happen in the upper cervical part of the spine. So if, standard type injuries, if it's more postural, so if we do postural correction, we're going to focus more on the mid-cervical spine. When you have auto injuries, typically C4, C5, that region is more involved because most of your extension takes place at C4. So when your neck bends back or extends, that's at C4. C5 is going to be more flexion, which bending forward. So with acceleration, deceleration injuries, the head is going to move differently from the body. So if your head is here and your body is here and it's accelerated, that's the same as the whiplash type motion. So your neck is going to be thrown back and it's going to cause injury to the facet joints. Now your facet joints are these joints on the side here and they help handle the load of your head. So there's 3 points of contact. You have a disc in the front, you got your facets on the side. So a facet on each side and a disc in the front. So when your body is accelerated and your head is, and then catches up, so you have an acceleration, deceleration at different times, the facet joints become compressed. So they typically touch, and that's where you have your normal curve. But when their head is extended back, you cause compression of the facets. They no longer want to touch because they become inflamed. And then you have a whiplash type presentation. So you have more of a straightened neck, and that would be a postural thing. So then we look at, all right, do we need an MRI? Are we getting radicular symptoms down the arm? What part of the arm? If it's more arm related, we know it's going to be more mid to lower. If it's more of a maybe a shoulder blade referral, then you're going to look at the lower cervical spine. So typically any type of impact or injury to the neck that involves rotation is going to be upper cervical. Mid cervical spine is going to be extension flexion, more front to back type injuries. The lower part, which is going to be C5, C6, C7, that is mostly responsible for lateral flexion. So when you have lateral impacts or lateral injuries, that's going to affect more of the lower cervical. It'll have a different presentation. The injury to this area is going to be more of a referral to the parascapular region. So patients will come in and say, I feel pain between my shoulder blade and my spine. And that's what that tells me, all right, that's going to be more of a lateral component, more of a lateral flexion type injury. So when you look at the neck, you really have to look at it in three regions. Is it going to be more headache, upper cervical? Is it going to be more postural correction? If they're coming in with the neck straightened like this, if it's chronic, or just a typical injury, then we would work on the mid-cervical spine because we want to enhance that curve back. So to do that, our adjustments would be more focused on creating that anterior presentation. For the lower part of the spine, it would be more of a lateral flexion type maneuver. Upper cervical is going to be more of a rotary type movement. So you've seen chiropractors adjust where the head turns. They're working more on the upper cervical part of it. Typically, when you have the facets adjusted, that can be done face down or face up. The lower cervical is going to be more of a lateral type movement. So depending on how that happens, where the injury is, that would determine what type of adjustment. So we're going to demonstrate some adjustments today. We're going to go upper cervical, mid cervical, and lower cervical to show you the difference, and see how that goes.